What's up, everyone? Welcome back to the Chesapeake edition. This is your host, Casey Gilchrist. Welcome to my office. The Chesapeake edition has now transformed into a video podcast. Can you believe it? I know I can't. But this pandemic is causing all of us to step outside our comfort zone and try new things, and our department decided to give this a whirl. So if you guys like it, maybe we'll consider continuing the video podcast platform once we all get back to our new normal. So I also wanted to share with you guys, we did not completely abandon our traditional podcast format. You can still listen to this episode over wherever you receive your podcasts, whether that's Apple Podcasts, Spotify, Stitcher. I don't know any others, but if you have any others, go listen to it on that. So for this week's first virtual podcast, we decided to invite a very special guest. Amber Egyud of Chesapeake Regional Medical Center joined me today, and we had an awesome conversation on how regional is responding to the COVID pandemic and how their expansion is continuing. Their $85 million expansion, might I add, is continuing despite the pandemic. So I hope you guys enjoy, and hope you all are staying safe and healthy and sane. So I guess I'll see you guys on the next video podcast. Bye. All right, Amber Egyud, thank you so much for joining us. Amber is from Chesapeake Regional. She is the Chief Operating and Nursing Officer there. So Amber, how about you tell us more about you and your role at the hospital?
Sure. I am, as you mentioned, the Chief Nursing and Chief Operating Officer here at Chesapeake Regional. I joined the organization in September of 2017. I have always worked in healthcare. I started as a nurse, always wanted to be a nurse, and worked clinically, then administratively into different leadership roles, and have escalated into the executive level of healthcare for probably about the last 8 years in executive roles in organizations similar in size to Chesapeake. And my family and I have always wanted to live closer to the Outer Banks. So when I had the opportunity to join Chesapeake Regional, it was a good fit for me, both professionally and personally. So
Awesome.
I've really enjoyed being a part of the community.
Oh, awesome. And I've heard through a little birdie at my office that you lived in West Virginia prior to this and worked in Pennsylvania.
Yes, so I lived in right in the border of Weirton, West Virginia, and it's about 36 miles from the city of Pittsburgh. So it's a very easy commute. And yes, I'm originally from Pittsburgh, Pennsylvania, born and raised there, and lived in Weirton, West Virginia for about 21 years.
Oh, wow. So big change climate-wise, you would say?
Yes, absolutely. I'm enjoying many more sunny days a year than in the Pittsburgh area.
I can imagine that. So kind of just jumping into the meat and potatoes of the conversation, I know we're all dealing with this pandemic, and Chesapeake Regional is an outstanding institution in our community. I know a lot of people want to know how Chesapeake Regional has been affected by COVID. Can you kind of talk about how your response has been?
Absolutely. So our response, like other healthcare organizations, has really been in uncharted territories for the healthcare industry. So we have relied heavily on data, heavily on our regional and national and state level partners to help learn as much as we can on a day-to-day basis from the CDC, from the Department of Health, to really guide how we prepare and care for our community during the COVID-19 pandemic. It has been, it's really, as I mentioned, it's uncharted territories. We have quickly prepared to safely care for our community and for each other during this pandemic, using the latest evidence available daily and lessons learned from other areas of the country and other countries who have the unfortunate experience of experiencing COVID before us. So we've had a lot of lessons learned that help us develop protocols, policies that best address decreasing community spread and treating our patients who arrive here at Chesapeake with the most up-to-date care.
Awesome. And I know in a lot of our meetings that we have in our department, we're hearing that unemployment is affecting everyone across the nation. But to my surprise, and to the surprise of a lot of people, it's affected the healthcare industry significantly. And my mom works in the healthcare industry, and I know she's seen it in her office. Has it affected regional very heavily at all?
So with healthcare, one of the one of the biggest things that we prepared for is a large patient surge of patients that were acutely ill needing hospitalization. And then, of course, the PPE conservation and issues. So, in order to obtain our PPE, in order to make sure that we had enough capacity to treat those patients that we expected to see, we did stop across the country elective procedures
Yep.
and other types of screening exams, such as mammograms and other things that bring a lot of volume to hospitals. So, in stopping those procedures to prepare for a surge. And we are very happy we never got the surge. So that's a good
Yeah.
thing, to be prepared and not have that surge of patients. We did a great job social distancing. We were able to flatten that curve. But unfortunately, it did affect the volume of the healthcare industry everywhere. So from,
Mm-hmm.
people are staying home and not coming to the ER for things that they would normally come to the ER for. Our surgeries are not happening. Our elective testing has been decreased. So we have seen a significant volume loss. And what we have done here at Chesapeake Regional is really try to take those employees who were experiencing volume losses in their department and redeploy them into what we call temporary duty assignments. So we need, as a part of planning for a pandemic, there's other roles that needed to be filled outside of what someone would normally do in a day-to-day workday, such as screening at the entrances. So having the ability to take people in areas where there's lower volume and have them be our screeners at the entrances and the ones that enforce our visitor restrictions was very helpful. We had to prepare for a PPE distribution process to maintain our PPE supplies. And so we redeployed some of those employees into the PPE team. So we've done a good job in temporary duty assignments and helping shift the work to newly created workflows.
Well, that's awesome. And I know Regional has an outstanding workforce. So the fact that they can be versatile and help in other areas that they're normally not in, it's really amazing to hear that.
It is
And go ahead.
as all of our employees here are truly heroes. They just
Oh.
have responded with the flexibility
Mm.
and commitment to our organization, our community, that has just been outstanding.
Yeah, definitely. I agree 100%. The governor, I think this past week, maybe yesterday, announced that Virginia is going to be reopening, at least somewhat in phase one, next Friday, the 15th, I believe. Is Regional ready for, additional workload should, the pandemic resurge, if you will? How is Regional preparing for the reopening of businesses?
That's a great question. And we have prepared with the ramp up of our services and making sure that how we administer, order, and our PPE practices moving forward have been changed forever. So we've learned a lot that will help us be prepared in the future should another resurgence of COVID be realized. We will be prepared to care for those patients with the surge capacity planning that we have done in the last 8 weeks. We have worked in a tiered surge capacity approach on areas of the hospital that we would open up. We have received approval to open up those areas as additional patient care beds, and how we practice medicine is going to change. So there's a new normal for the healthcare industry, and we have been preparing for that for several weeks now, and I am confident that we will be able to meet the needs of our community moving forward.
Awesome. That's so reassuring to hear, not only for myself, but I'm sure the citizens that are part of Chesapeake. Do you have any tips that you would give to the citizens going back to work, or maybe stay-at-home moms who have people coming back home? How do they protect themselves, I guess, when they go back?
Absolutely. So one of the best things we can do with any outbreak is good hand washing, good physical distancing, not touching your face, making sure that you're complying with infection control standards. So, if you're sick, stay home. If you have respiratory illness, it's best to just stay home and sit it out rather than take a chance on spreading to colleagues or anyone at the grocery store or anyone else you might have in contact. So, I think those basic premises of what we learned during physical distancing over the last 8 weeks is stay home when you're not well, wash your hands, maintain physical distance, and make sure that you're not touching your face. And again, it's good hygiene. Good hygiene and safe social distancing will help us get through this until there's a vaccine.
Definitely. And assuming that you'd have the same advice for business owners, but are there any additional comments that you would give to business owners who are reopening next week?
Absolutely. I think that they should do it with some thoughtfulness on how they will maintain social distancing and good environmental cleanliness. So, a restaurant, how will you wipe down your ketchup bottles, your salt and pepper shakers, your tables, your chairs
Mhm.
after each customer has finished, because it's those kinds of transmission spreads from that we have to be careful about cash registers and touching pin pads, and how will we accommodate that in the future of wiping it down or having hand sanitizers available at different places in your business regardless of your type of business, not just but at a checkout of having
Yeah.
hand sanitizers if you're a business owner that is a retail owner, of having hand sanitizers and good processes for environmental cleanliness, depending on your business.
Awesome. And I was wondering, is Chesapeake Regional accepting PPE? I see this huge, I don't want to say trend, but it's a great trend of people donating to hospitals. Are you guys accepting PPE?
We are accepting PPE, and if you go to our webpage or Facebook page, there's a donate tab that tells you how to donate, what we're accepting, and where the drop offs are.
Okay, awesome. And I'll be sure to provide that link in the podcast details section so people
That'd be
can go and
great.
click on that. Awesome. And one amazing thing that happened earlier this year was the announcement of Regional's $85 million expansion. I drove past the hospital this past weekend and I noticed that crews are still out, like building. Can you speak to how the expansion is moving forward despite COVID?
So luckily, we're in the early phases of construction where most of the work is outside. So
Mhm.
none of the work has been inside of the hospital. So it hasn't impacted construction timelines because of the nature of the phase of construction that we're in right now. So what you see happening is the expansion of a cancer treatment center, which will
Mhm.
open next February of 2021. And we're very excited about the cancer treatment center because it's going to expand to allow for capabilities to have comprehensive care in this community. So if it's going to be a one-stop shop for patients that are dealing with cancer diagnosis, they'll be able to have all the treatment that they need in one spot, with the addition of additional technologies, additional specialties, and additional spaces. So we are very excited about that piece of our expansion. We've also expanded our parking, and it
Mhm.
was much needed. So the parking expansion is a part of the construction that you see at this time. And then we are adding a critical care tower where we will shift our critical care beds into one location. So we'll have a 30-bed critical care unit
Oh, wow.
and a 28-bed step-down unit and a 36-bed telemetry stroke unit, which will allow us to provide modern technologies in a patient-centered and patient and family-centered environment for healing. So we're very excited about the tower expansion, and we are also renovating our mother-baby unit to
Awesome.
offer the modern amenities that women would expect at that period of their lives. So we're very pleased to be able to renovate our mother baby area, and we are adding a new OR. So we received our COPN from the state of Virginia for an additional OR. So we are constructing an additional OR that will allow for a larger space for robotic technologies and other surgeries expansions that we have planned for the future.
That's awesome. And it's great to hear that it can still move forward despite the pandemic that we're all experiencing right now. So I can't wait for that ribbon cutting of all of the final uh, facilities that you guys have coming. So I know I want to send a huge thank you. I know you're super busy right now for taking time out of your day to come on our podcast. I know it's a new format video, so I know it's a little weird sometimes. So I appreciate you for being a good sport, and uh, I'll definitely put your contact information if people want to reach out or have any additional questions to our podcast.
Well, thank you. I appreciate the opportunity to join you today.
Awesome. Stay safe.
Thank you.